Hello, everyone. I'm Natalie Kunzman, MD, and today we're going to investigate long haul COVID. So, what is this terminology implying? Well, we have called the long haulers who have experienced COVID 19 infections as those people who are having very prolonged or protracted symptoms. Some of these symptoms are quite variable and include continued shortness of breath, loss of taste and smell, joint pain, body aches, extreme fatigue, difficulty sleeping, headaches, and brain fog. Now, of course, there might be more as we are getting more data over time. So currently, the medical and public health communities don't really have a good handle on COVID 19 and what to expect, let alone how to really define all of this long term and chronic phase symptoms. So many of the long haulers, I have to say, are not necessarily those severe patients who are hospitalized, who are severely immune compromised, and may include a lot of individuals who only have experienced mild or moderate cases. And I've already seen some of this in our younger folks. So far, Johns Hopkins has the longest COVID ongoing long study and has one of the largest studies to date. So, what is causing these prolonged symptoms? And I've said over and over in this pandemic that this is uncharted territory and we are getting the facts as they are coming along. So, one theory about the patients with long-term COVID is that maybe the virus is possibly remaining in their bodies longer and in some small form. Another theory is that the immune system just continues to overreact even though the infection is long past and is leaving a post-infectious inflammatory phase. However, I am going to go out on a limb and propose several other issues as I assess the patients that I see. I believe that there is the potential for an immune cascade that can continue and create an autoimmune-like symptom. And a lot of people understand this when they talk about Epstein-Barr being a prolonged virus that can cause chronic fatigue syndrome. And I also propose, as do some other experts in functional medicine, that it could, having COVID-19 can cause reactivation of other underlying co-infections, which can make this picture really tricky. Now, the other pieces of this that I will go out on a limb to say is that I believe that the adrenal glands and the cellular energy has been affected. Now, I believe that those adrenal glands and the mitochondria down at the cellular level, which are those battery packs, really take a big hit. And I describe some of these big infectious fights, such as COVID-19, as running a few Boston marathons in 1 week. Now imagine what that would do to your cellular energy and your adrenal glands. It takes a lot of recovery from one marathon, let alone many. And there's only so much energy to go around. This is our chemical description of the cell and the adrenal energy, but we always must consider our energetic fields, those biophotons down at the DNA level, and that biofield that is also woven within our human matrix, and where this study is concerned is still in its infancy. Now, some patients who have been seriously ill from COVID-19 develop acute respiratory distress syndrome, or ARDS, and that can permanently scar their lungs. But it's not clear if there is any scarring for the long haulers who have had some respiratory issues, but not ARDS itself landing them in the hospital. Now, for a lot of the other patients with that long-term loss of sense or loss of smell and taste, they actually worry about permanent damage too. Now, so far, the experts believe that the loss of smell and taste won't be permanent. And for most people, there will be a resolution, but there still is not a clear answer as to how long this will take. Now, receiving a vaccine after long haul symptoms really must be individualized. Of course, this is also uncharted territory, but given the activation of the innate and the adaptive immune systems with the messenger RNA type immunizations, the body might be too vulnerable to activate the wheel of the RNA and the DNA machinery to work very well, let alone all of the inflammatory cascading that comes with the innate activation of the immune system. Now, again, this might simply be too much for the body to handle as it's trying to heal, and even more chronic fatigue and symptom complex may compile on top of what already exists. So this is not a vaccine discussion per se, but this needs to be individualized for the patient. Now, keep in mind that the ideal situation is a bunch of studies that can yield us a bunch of results, but some patients right now do not have time for a double-blinded placebo-controlled study. So the criticism of some of these approaches really should back off. And some of these approaches for the long haul syndrome come from the MERS and SARS and the holistic and functional approaches to immune challenges in general. So here are some things that we are proposing for some of those long haul symptoms. And again, once we can figure out if this is ACE2 activation or endothelial dysfunction or adrenal or mitochondrial based issues, has yet to be determined, but we can extract previous responses to previous illnesses. So for the long haul, again, diet is foundational. It is foundational in functional medicine, and this must get started immediately. So what we are talking about is a diet that helps the immune system rather than harms. Sugar absolutely harms and is a big disruptor of the immune system. So absolutely no sugar. And what we are looking for in this diet is protein, fiber, healthy fats, and those micronutrients that the immune system needs to thrive. So for instance, an insufficiency of zinc and selenium are associated with worse outcomes from all viral infections. So we need to ramp that up. Now there are some phytonutrients found in green tea, which is EGCG, which is a polyphenol, and curcumin, which is found in turmeric, can actually decrease inflammation and rebalance the immune system. So when we are talking about an immune fight, we are talking about at least 12 servings of vegetables and fruits with some lean meats. And don't forget, absolutely no junk food. Now, NAC is an amino acid in our bodies that creates glutathione, which is our body's master detoxifier. So glutathione has a very big impact on balancing the immune system. And all of the cruciferous family of vegetables, which is broccoli, cauliflower, Brussels sprouts, and cabbage, they can actually help us extract more N-acetylcysteine. And N-acetylcysteine is very important for those people who get short of breath, and it also has the ability to break down those really small microemboli or microclots that may be a portion of some of the severe illness and the long hauling. Now, vitamin D, also one of our biggest immune modulators. And during the COVID battle, I have patients ramp up to 10,000 IUs, which is international units, of D3 on a daily basis for a while. Resveratrol right now, which is found in the skin of the grapes, has been used in some functional medicine clinics in New York City with some very good results for the long hauling patients at about approximately 200 milligrams twice a day. Now, interestingly, fasting also supports the turnover of damaged cells throughout the body, which will make room for new, healthy mitochondria and cells to take over their place. So various strategies of time-restricted eating or different fasting strategies can be employed. Now, if the microbiome, which is our gut bacteria, and don't forget we have a virome, and we also have some parasitic commensal bugs that live with us at all times, that can actually be disturbed in an aggressive immune battle. So replenishing, especially spore-based probiotics, to create a very wide, diverse microbiome is best. And we know that bacteria, and again, there's 10 bacteria for every one of our human cells, they're very well equipped to fight off viral infections. Yes, not just human cells, but our bacterial cells can get infected with viruses, and that bacteria has developed very good strategies to defeat viruses. And of course, this is budding and brand new territory about how to optimize our bacteria for this fight. Now, melatonin in the throes of the severe illness, and actually in our cancer talks, at higher doses has been employed, especially with those that have the respiratory compromise of COVID-19. But even simply using the lower dose of melatonin at 1 to 5 milligrams at nighttime to improve our sleep can help with our cellular regeneration and our immune system. Now, quercetin is also a flavonoid that's found in dill and broccoli and onions and capers and apples and berries. It is a mast cell stabilizer. And mast cells release more than histamine. They can actually release heparin and other immune chemicals that have been proposed in the cytokine storm. And of course, we will use quercetin in people with severe allergies and asthma and those who need mast cell stabilization. But we also know that the mast cells are found in all connective tissues throughout the body, and it can help us reduce some of those symptoms in the SARS and CoV-2 infection. The quercetin itself can actually bind to that spike protein of the coronavirus, which can inhibit some of these inflammatory pathways, and it can block replication of infected cells. So it is an antiviral and it is completely safe, especially at around 500 milligrams twice a day. Don't forget about our friend turmeric, which is an anti-inflammatory packed with a punch if we have fermented foods with it. Now, of course, my approach is going to start with some at-home remedies if you are mild, but don't forget, there are 2 other proposals that I believe are playing a big role in those patients I'm seeing with long-haul symptoms. I believe the adrenals have taken a hit, and many people are acting as though they have extreme adrenal exhaustion. So I will do saliva testing. I will start recommending adaptogens. The body absolutely needs rest in this state as well as a low stress environment. The second thing that I'm starting to observe is the cellular fatigue, which is coming from the mitochondria. And of course, the mitochondria can be supported and I can do some measuring with some of the sophisticated tests that will get down to the cellular level and assess the nutrients that have been involved in some of this depletion. And to that note, there are some great blends and herbal support that will also include CoQ10, magnesium, D-ribose, zinc, and all of those nutrients that we need to keep ATP going in that Krebs cycle in our cells. Now, I also believe in being comprehensive and having an evaluation with energy workers who have knowledge in those meridians and energy centers that need support from that energetic depletion. This might include red light and infrared therapies, massage work, pulse DMF, acupuncture, balancing. I also subscribe to higher doses of vitamin C, and I don't want to say specific doses because if those have G6PD deficiencies, really need to seek a lot more physician guidance with this. Herbs that could be in a blend to support a viral fight. I might employ herbalists or naturopaths that do even more of this than I do. And we need to talk a little bit about some of the repurposed medications that are being researched and studied. And one of those is ivermectin, and there may be a role for this, not only in the throes of the illness, but also in the long hauling phase. There is also research out there for some of the new peptide solutions. I am not using them, but I am researching them. There are also some studies underway employing LDN with N-acetylcysteine and glutathione support. And some of the larger clinics scattered throughout the country are starting to employ multidisciplinary teams to work on that long hauling phenomenon to figure out who is at risk, how to go after that, and how to fix it and get us back to our optimal health. There you have it, long haul COVID, budding information, always evolving as we are speaking. I'm Natalie Kunzman, MD. Subscribe to my channel below. And until we meet again, be well